Namaste to all. Myself JVM Dr. Suman Shekhawat, Department of Kaya Chikitsa, Faculty of Ayurvedic Sciences, JAYOTI VIDYAPEETH, Women's University, Jaipur. Today we will be discussing about Alzheimer's disease. In this first CT image, you can see the difference between normal brain size and brain atrophy. First of all, introduction of Alzheimer's disease. Alzheimer's disease or AD, also known as senile dementia of the Alzheimer's type, senile dementia, Alzheimer type, SDET, and simply Alzheimer's is the most common form of dementia. This incurable, degenerative, terminal disease was first described by a German psychiatrist and neuropathologist Alois Alzheimer in 1906 and was named after him. Alzheimer's disease is a slowly progressive disease of the brain that is characterized by impairment of memory and eventually by disturbance in reasoning, planning, language, and perceptions. Many scientists believe that Alzheimer's disease results from an increase in the production or accumulation of specific protein, beta amyloid protein, in the brain that leads to nerves and death. Generally, it is diagnosed in people over 65 years of age, although the less prevalent early onset of Alzheimer's disease can occur much earlier. In 2006, there were 26.6 million sufferers worldwide. Alzheimer's is predicted to affect 1 in 80,000 people globally by 2050. Symptoms of the disease: early stage. This is considered as a mild or early stage, and the duration period is 2 to 4 years. Frequent recent memory loss, particularly of recent conversation and events. Repeated question, same problems expressing and understanding language. Writing and using objects become difficult and depressing, and apathy can occur. Drastic personality changes may accompany functional decline, need reminders for daily activity, and difficulties with sequencing impact driving early in this stage. This is the early stage. Second stage of the disease is this is considered as a middle or moderate stage, and the duration is 2 to 20 years. Duration of early stage is 2 to 4 years, and duration of second stage is 2 to 10 years. Can no longer cover up problems. Pervasive and persistent memory loss impact life across settings. Rambling speech, unusual reasoning, confusion about current events, time and places. Potential to become lost in familiar settings, sleep disturbance, mood and behavioral symptoms, escalate. Nearly 80% of patients exhibit emotional and behavioral problems, which are aggravated by stress and changes. Slowness, rigidity, tremors, and gait problems impact mobility and coordination. Need structure, reminder, and assistant with activities of daily living. In second stage, it is important need structure, reminders, and assistant with activities of daily living. Moderate stage, increased memory loss and confusion. Problem recognizing family and friends. Inability to learn new things. Difficulty carrying out tasks that involve multiple steps, such as getting dressed. Problem coping with new situations, delusion, paranoia, impulsive behavior. In moderate Alzheimer's disease, damage occurs in area of the brain that control language, reasoning, sensory process, and conscious thoughts. Last stage of the disease is this is considered as the severe stage, and the duration is 1 to 3 years. Confused about past and present, loss of recognition of family people and places, generally incapacitated with severe to total loss of verbal skill. Patient unable to care for self, falls possible, and immobility likely. Problems with swallowing, incontinence, and illness. Extreme problem with mood, behavior problem, hallucination, delirium. Patient needs total support and care and often die from infections or pneumonia, such as pneumonia. Diagnosis of the disease is Alzheimer's disease is usually diagnosed clinically from the patient's history, collateral history from relative and clinical observation based on the presence of characteristic neurological and neuropsychological features and the absence of alternative conditions. Advanced medical imaging with computed tomography, CT, or magnetic resonance imaging, MRI, and with single photon emission computed tomography, positron emission tomography can be used to help exclude other cerebral pathology or subtype of dementia. The diagnosis can be confirmed with very high accuracy. Post mortem with brain material is available and can be examined histologically. Causes. Scientists don't yet fully understand what causes Alzheimer's disease, but it is clear that it develops because of complex series of events that take place in the brain over a long period of time. It is likely that the causes include genetic, environmental, and lifestyle factors. Some drug therapies prevent that Alzheimer's disease is caused by reduced synthesis of neurotransmitter acetylcholine. Other cholinergic effects have also been proposed, for example, initiation of large-scale aggregation, initial initiation of large-scale aggregation of amyloid leading to generalized neuroinflammation. Alzheimer's disease is characterized by a buildup of protein in the brain, though this can't be measured in a living person. Extensive autopsy studies has revealed this phenomenon. This buildup may manifest in two ways: plaques and tangles. Plaques, deposits of the protein beta amyloid that accumulate in the space between nerve cells, and tangles, tangle deposit of the protein tau TEU that accumulate inside the nerve cell. These are two buildup proteins. Plaques deposit between nerve cells and tangles deposit inside the nerve cells. Neuropathology of Alzheimer's disease. Alzheimer's disease is characterized by loss of neurons and synapses in the cerebral cortex and certain subcortical regions. This loss results in gross atrophy of the affected regions, include degeneration in the temporal lobe and parietal lobe, especially degeneration in the temporal lobe and parietal lobe, and part of the frontal cortex and cingulate gyrus. Both amyloid plaques and neurofibrillary tangles are clearly visible by microscopy in brain of those affected by Alzheimer's disease. Plaques are dense, mostly insoluble deposits of amyloid, beta peptides, and cellular material outside and around neurons. Tangles, neurofibrillary tangles are aggregate of the microtubules associated protein tau, which has become hyperphosphorylate and accumulate inside the cell themselves. Although many older individuals develop some plaques and tangles as a consequences of age, the brain of Alzheimer's disease patients have a greater number of them in specific brain regions such as the temporal lobe. Mainly it is affected are parietal and temporal lobe. Both are affected. Atrophic changes we can see, especially in parietal and temporal lobe. Mechanisms of the disease is aggressive. Symptoms of Alzheimer's disease used to delay or slow the disease. Donepezil loses its effect over time, used for mild, moderate, and severe Alzheimer's disease. Doesn't prevent or cure Alzheimer's disease. Celexa, citalopram, used to reduce depression and anxiety, may take 4 to 6 weeks to work. Sometimes used to help people get to sleep. Dipacot or sodium valproate used to treat severe aggression, also used to treat depression and anxiety. Exelon or rivastigmine used to delay or slow the symptoms of Alzheimer's disease, loses its effect over time, used for mild to moderate Alzheimer's disease, can get in pill form or as a skin patch, doesn't prevent or cure Alzheimer's disease. Namenda or memantine, used to delay or slow the symptoms of Alzheimer's disease, loses its effect over time, used for moderate to severe Alzheimer's disease, sometimes given with Exelon, doesn't prevent or cure Alzheimer's disease. Residine or galantamine, used to prevent or slow the symptoms of Alzheimer's disease, loses its efficacy over time. Used for mild to moderate Alzheimer's disease, can get in pill form or as a skin patch, doesn't prevent or cure Alzheimer's disease. It can be found in skin patch also. Doloft or sertraline, used to reduce depression and anxiety, may take 4 to 6 weeks to work, sometimes used to help people get to sleep. Trileptal or oxcarbazepine or anxiety, used to treat severe aggression, also used to treat depression. Carbamazepine and anxiety. Carbamazepine used to treat severe aggression, also used to treat depression and anxiety. Remeron used to reduce depression and anxiety. Metazepine may take 4 to 6 weeks to work and sometimes used to help people get to sleep. How these drugs works? Although there is currently no way to cure Alzheimer's disease or stop progression, researchers are making encouraging advances in the Alzheimer's treatment, including medication and non-drug approach to improve symptom management. In mild to moderate Alzheimer's disease, cholinesterase inhibitors increase the level of acetylcholine in the brain, which plays a key role in memory and learning. This kind of drug postpones the worsening of symptoms for 6 to 12 months in about half of the people who take it. Cholinesterase inhibitor most commonly prescribed for mild to moderate Alzheimer's disease include donepezil, Exelon rivastigmine, and residine. These are cholinesterase inhibitors. And moderate to severe Alzheimer's disease, memantine regulates glutamate in the brain, which plays a key role in processing information. This drug is used to treat moderate to severe Alzheimer's disease and may play the worsening of symptoms in some people. It may allow patients to maintain certain daily function a little longer than they would without the medication. Residine delays the worsening of Alzheimer's disease symptom for 6 to 12 months in about half of the people who take it. Residine is available in tablet form, capsule form, and is commonly started at 4 mg twice a day. If it well tolerated, after 4 weeks the dose may be increased to 8 mg twice a day. Residine also comes in an extended release once in a day tablet. Residine is available in generic form also. Galantamine HBr. Exelon is a cholinesterase inhibitor that prevents the breakdown of acetylcholine and butyrylcholine in the brain by blocking the activity of two different enzymes. It is acetylcholine and butyrylcholine may play a key role in memory and learning. When given orally, bioavailability is about 40%. In the 3 mg dose, the compound can cross the blood-brain barrier. If we are talking about Aricept is available in tablet form or an orally disintegrating tablet form and is commonly started at 5 mg in a day, can cross the blood-brain barrier. Studies involving Namenda have shown that the drug can slow the rate of decline in thinking and ability to perform daily activities in individuals who have moderate to severe Alzheimer's disease. A dysfunction of glutamatergic neurotransmission is thought to be involved in the etiology of Alzheimer's disease. Namenda is available in generic form also. Thank you so much. I hope you all have understood this session. If you feel any kind of query with this session, please mention it in comment box. I will try to resolve it soon. Thank you.